Assalamu alaikum students. I am Dr. Aisha Majid from the Anatomy Department of Amiruddin Medical College, PGMI Lahore. And today I will going to teach you about pericardium anatomy. At the end of the lecture, you would be able to understand what pericardium is, layers of pericardium, its relations and its attachments, pericardial sinuses, and the contents of pericardium, its blood supply and innervation, and at the end clinical anatomy or the applied anatomy. So let's start it with the pericardium. In this cadaveric picture, you can see there is a thoracic cavity or thoracic cage in the center. Here in the center is a heart which is surrounded by a whitish membrane or the covering, which is pericardium. Now, what pericardium actually is? Pericardium is a Greek word. Peri mean around and cardia mean heart. It is a fibroserous closed sac which encloses heart and root of great vessels situated in the middle mediastinum. Mediastinum is the central part of the thoracic cavity. It consists of fibrous pericardium and a serous pericardium or fibrous sac or the serous sac. Now here is some detail about fibrous pericardium. Fibrous pericardium is a conical sac which is outer tough layer, and it has embryological origin from collagen and elastic fibers, which is dense connective tissue. And, it has an apex which is blunt and lies at the level of the sternal angle. Here in this picture you can see sternal angle, and it is fused with the root of great vessels and the pretracheal fascia. In this picture you can see also root of great vessels and the trachea. Base is broad and inseparably blended with the central tendon of the diaphragm. Anteriorly, it is connected to the upper and lower ends of the body of the sternum by the weak superior and inferior sternopericardial ligaments. Inferiorly or inferior wall, or you can say floor of fibrous pericardium, is firmly attached and partially blended centrally with the central tendon of the diaphragm. They are inseparable, not even on dissection. The site of continuity has been referred to as the pericardiophrenac ligaments. Laterally on each side, it is related to the mediastinal pleura, mediastinal surface of the lung, phrenic nerve, and the pericardiophrenac vessels. Posteriorly, it is related to the principal bronchi, esophagus, and the nerve plexus around it, and the descending thoracic aorta. Okay, due to all these attachments, it is affected by the movements of the heart, great vessels, sternum, and diaphragm. And this fibrous exterior lining prevents overfilling of the heart because of its fibrous and resilient nature, and it is inflexible, inelastic, closed sac. It does not stretch. Okay. Now what is serous pericardium? It was all about the fibrous pericardium. Now what is serous pericardium? Serous pericardium is thin double-layered serous membrane lined by mesothelium, which are the squamous cells, as you all know. The outer layer or the parietal pericardium, it has serous pericardium, again has two layers, outer parietal layer and the inner visceral layer, or you can say epicardium. Outer parietal pericardium is fused with the fibrous pericardium, and the inner or the visceral pericardium epicardium is fused with the heart, except along the cardiac grooves, where it is separated from the heart by blood vessels. These two layers are continuous with each other at the root of great vessels, i.e. ascending aorta, pulmonary trunk, two vena cava, and the four pulmonary veins. Here lies a potential space which is called pericardial cavity between the parietal pericardium and the visceral pericardium. It contains a thin film of serous fluid which is secreted by the mesothelial cells, and it lubricates the opposed surfaces and allows the heart to beat smoothly. Okay. And in the corner, in the right corner, there is a box which is shown the functions of the pericardium. So it was all about the layers of the pericardium. Now, what are the pericardial sinuses? Sinuses in this picture, cadaveric specimen is shown. In the left side there is a transverse sinus, and in the right picture there is an oblique sinus which lies behind the heart. Oblique sinus is located behind the heart. Now, what is transverse sinus and how they form or they develop? In this picture, you can see the longitudinal embryonic heart tube invaginates the double-layered pericardial sac. The primordial heart tube then loops ventrally, bringing the primordial arterial and venous ends of the heart together and creating the primordial transverse pericardial sinus. In this picture, you can see at the left side, and then in the picture ventrally mention T, which shows transverse pericardial sinus. Here it is a location of the transverse pericardial sinus. Now, at the end of the picture, in the last picture, in this diagram, last picture, which shows primordial arterial and venous ends of the developing heart are brought together, forming transverse pericardial sinus. It shows the actual location of the transverse pericardial sinus. These sinuses are very important for you to understand, and it is an important UQ. So learn it carefully. With the growth of the embryo, the veins expand and separate apart inferiorly and laterally. The pericardium reflected around them forms the boundaries of the oblique pericardial sinus. In the picture, inferiorly you can see inferior vena cava, superior vena cava. Or in more easy words, you can define the sinuses as transverse pericardial sinus is a horizontal gap between the arterial and venous ends of the heart tube. It is bound anteriorly by the ascending aorta, pulmonary trunk, posteriorly by the superior vena cava, inferiorly by the left atrium, and on each side it opens into the general pericardial cavity. Okay, now about the oblique sinus. Oblique sinus is a narrow gap behind the heart. As I already told you, it lies behind the heart. Here is a picture which shows actual location of it. This is the anterior view of pericardial sac. To remove the heart from the sac, the 8 vessels piercing the sac were served. The oblique pericardial sinus is circumscribed. In this picture you can see red dots or red stars, which is the actual location of the oblique pericardial sinus. In this picture, the oblique pericardial sinus is circumscribed by 5 veins: superior vena cava, pulmonary trunk, and especially the aorta have intrapericardial portions. The peak of pericardial sac occurs at the junction of the ascending aorta and the arch of aorta. Okay, or it develops due to the rearrangement of veins and the venoscent. Now it's all about the sinuses. Sinuses are very important to know. And here is the surgical significance of transverse pericardial sinus also. It is especially important. Transverse pericardial sinus is especially important for cardiac surgeons. After the pericardial sac is opened anteriorly, a finger can be passed, as you can see in this picture. A finger can be passed through the transverse pericardial sinus posterior to the ascending aorta and pulmonary trunk. Here in this picture you can see clearly. By passing a surgical clamp or a ligature around these large vessels, inserting the tube of a coronary bypass machine, and then tightening the ligature, surgeons can stop or divert the circulation of blood in these arteries. While performing cardiac surgery such as CABG, you can say, or the coronary artery bypass grafting. So it is an important question. Surgical significance of transverse pericardial sinus is important question for your examination. In this picture you can also see the interior of the pericardial sac. In this picture is shown the 4 veins: pulmonary veins, aorta, pulmonary trunk, superior vena cava, and the inferior vena cava. You can now easily tell me about it is the location of the oblique pericardial sinus. You can identify the position of the oblique pericardial sinus. Now it was all about pericardial sinuses. Now you can see the contents of pericardium. You can tell me easily now about after all these lecture. Heart, you can see heart with cardiac vessels and nerves is its major constituent. Ascending aorta, then pulmonary trunk, lower half of superior vena cava. In this picture you can see these are the pericardial contents. Terminal part of inferior vena cava, and lastly the terminal parts of the 4 pulmonary veins. Okay, this picture clearly shows about all these contents of pericardial cavity or the sac. Now, what is a blood supply? In the blood supply, we will first tell about arterial supply and then venous drainage. Arterial supply is mainly from the cylinder branch of internal thoracic artery, the pericardiophrenic artery. Then smaller contributions from the musculophrenic artery, bronchial artery, esophageal, superior phrenic arteries, which are branches of thoracic aorta, and coronary arteries, the first branch of aorta. Now the venous drainage. Venous drainage is from the pericardiophrenic veins, tributaries of the brachiocephalic veins, and then variable tributaries of azygous venous system. Okay, now it's innervation. Innervation is the nerve supply, mainly phrenic nerve, which has a root value C3, C4, C5. It is the primary source of sensory fibers. Pain sensations conveyed by these nerves are commonly referred to skin of ipsilateral supraclavicular region, C3, 4, 5 dermatome region. And then the vagus nerve and sympathetic trunks vasomotor. Okay, it was all about the innervation, blood supply, and then innervation. Now, this is a picture taken from the FNetter, which has shown the heart in the situ and surrounded by the pericardium, whitish membrane, which is pericardium. Here you can see the outer fibrous layer, which has an apex, a base, on relations on either sides, on each sides, lateral sides you can say. Okay, now it's applied on the clinical anatomy. Its clinical anatomy, first of all, we can see there is an inflammation of pericardium, which is called pericarditis. Then pericardial effusion, excess fluid within the pericardial sac, which may lead to cardiac tamponade, compressing the heart. Cardiac tamponade जो है, cardiac tamponade is a potentially lethal condition, which you can say heart compression. Cardiac tamponade is heart compression. Here, a build-up of blood and other fluid in the pericardial sac puts pressure on the heart, which may prevent it from pumping effectively. In this potentially lethal condition, heart volume is increasingly compromised by fluid outside the heart but inside the pericardial cavity. Okay, blood in the pericardial cavity, hemopericardium, also produces cardiac tamponade. Hemopericardium may result from perforation of a weakened area of heart muscle owing to a previous myocardial infarction or heart attack, from bleeding into the pericardial cavity after cardiac operations, or from stab wounds also. This situation is especially lethal because of high pressure involved and the rapidity with which the fluid accumulates. Heart is increasingly compressed and circulation fails. Veins of the face and neck becomes engorged because of the backup of blood beginning where the superior vena cava enters the pericardium. Here you all know the fibrous pericardium blends with the root of this great vessel. It is a important question, UQ. It is an important university question. So, what will be the treatment how you can relieve the cardiac tamponade. We will perform pericardiocentesis. Pericardiocentesis, what is pericardiocentesis? Pericardiocentesis is the drainage of fluid from the pericardial cavity. It is usually necessary to relieve cardiac tamponade. To remove the excess fluid, a wide bone needle may be inserted through the left fifth or sixth intercostal space near the sternum, or subxiphoidal approach. You can say this approach is a subxiphoidal approach. This approach to the pericardial sac is possible because of the cardiac notch in the left lung, and the shallow notch in the left pleural sac leaves part of the pericardial sac exposed, the bare area of the pericardium. So care must be taken not to puncture the internal thoracic cavity and its terminal branches. So at your level, at for your for your question, for your university question, you only need to know about what will be the treatment of cardiac tamponade. You will perform pericardiocentesis and its location and its approach. Now in this picture you can see what is thoracocentesis. It is your your homework, or you can say it is your homework to differentiate between the pericardiocentesis or thoracocentesis. Go and find what is thoracocentesis at the end of the lecture. Okay, now hope you all understand what pericardium is and all you need to know about it. Thank you for listening. Thanks for your time. Allah Hafiz.